Hello and welcome back to my channel. Ka channel hello lom let's go into ka topic ron khan hi thil common mani Hmaibawl arangeng kan choidona. We will be talking about acne today. Acne is also known as in common term it's known as pimples, and it's a very long topic. It's a very common but long topic, so we will be breaking these videos into maybe one or two parts. The first part today we will be doing is how it comes about. Acne shimshim, Hmaibawl shimshim hi a topic alian ma chu wan chuan in video pakata soi zo sen lawa chu wan chuan when kan video chuan in tin nge lo ma enge I Hmaibawl li alo om chhan ti kan soi tlang puyanga treatment lampang chu video da kan da soi don ya. We will be talking about how it comes about, but since it's a very huge topic, we will only concentrate on the pathogenesis of acne, how it is formed, and we will not concentrate on the treatment part today. We are going to read again from my dermatology textbooks, and again I've picked here my very old manual. Going to hemi like abuto hen kan lo chair lenga topical in wangin atilam pangso kan chair don kan tika. So what is acne? Let's start reading. Acne vulgaris is very common. A common MMA chronic disorder. Chronic disorder om sia chu hunri tak treatment nan dochina arehar, involving inflammation of the pilosebaceous unit that can be varied in presentation and difficult to treat. Om sia chu pilosebaceous unit kan ti chu soi fia ta photila kan vuna yanin mul to na am he kan vun surface lo ni ta se kan vuna hen mula to ta ni mula to vek ta chuan he kan mula lo ni ta a kan mul bula yanin gland pakhat om ta ni sebaceous gland kan ti kham ta hemi sebaceous gland kan ti hi enge kan vuna oil production siam tu sebum kan ti aron swak kha I sebum ani me ta chu mi siam tu gland chu ni ta ni. So there's I'm explaining here what is the pilosebaceous unit, which is the basic structure which is important in acne vulgaris. So here we have the hair follicle and the hair. This is the hair which is growing. This is the skin surface. This is the hair, and so just next to the hair follicle we have a gland here, which is the sebaceous gland. Sebaceous gland is nothing but the gland in the skin which produces your sebum. Sebum is something which will give natural oils to your skin. So heta hian lo entaila heta hian oil produce ta sebum produce ta in siam ring ta ni chuan heta hianin ngong te le ten a in hong lai yom ta ni hei hi kan vun tam taka chuanin visible pores kan ti chuan hemi opening mi in hong te hi alan chian alan nen deu kan pores khan me a te deu chi no ma alian deu chi no ma hei alian dewa chuan atlang puin hemi gland hi activity asan chuan vun te amoma sebum production asanga chuan tlang puin Hmaibawl mi chuan oil production asanga mai amoma tin pores po alang lian tu ti ka shatring tur. So this is the opening, which is usually we call it the sebaceous gland opening, but in layman term it's called just simple pores. In some people it's visible, in some people it's not visible. Especially in acne prone skin, in people with a lot of acne, this sebaceous gland activity is high. That means there's higher production of sebum, and there's increase in release of sebum from this area, and usually the open pores will also be visible with the naked eye. Pores kanti tunitani. How does it happen? How does acne happen? Pathogenesis means how does it come about? Number one is stimulation of sebaceous gland to its abnormal keratinization of the follicular epithelium, leading to follicular plugging, proliferation and activity of Propionibacterium acnes within the follicle, and inflammation. And these are all medical terms which I will just be explaining here. So this means that in an acne eruption, the sebaceous gland activity is increased. That means increased oil production, and there are certain organisms which are living here It's called P. acnes, and with the increase in sebaceous gland activity, this will increase in the population. It's a bacteria, so it increases in population. So inflammation will occur around here. Inflammation means there's increase in redness, increase in inflammatory cells, so swelling will occur. Then pus formation can occur within this sebaceous gland. So this normal thing, which is like this, flat, in an acne eruption, because of the collection out here, it becomes like this. Kasoyom ziaju in shathiam tu koringa hemi sebaceous gland khan Hmaibawl mi chuan hemi activity aron san thut khan activity san ju hormones bangte ni theya thir tam tak bang stress bangte ni theya khami activity asan khan hemi production oil production sebum production ka ti sanga heta danna shik ombe sa shim kha hemi production asan ta ka khanin aron punga tu chon hnai asiama aron ti vung boka tu chanin Hmaibawl aron siam thinta ni chuan chu lawa choni helai open pores kan ti angka a pores opening akha e follicular keratinization kan ti omzet follicular keratinization kan ti omzet chu heta hianin e cells kha aron in build up a hemi opening ya titeya kata kan helaya sibam chuak reng tur kha a chuak theilawa in collect ta khami vel helai bor vel boya khan mai chu aron bol shin ta ni helaya mi kan siale lukange notira ka soi open pores nei how to and my mom tlang tuiti kha kan siara patients with patients with severe acne will usually have large and active sebaceous glands with prominent follicular openings, which are known as pores, and oily skin, which is known as seborrhea. Open pores kan ti chu mai mumle mai bolmia atambi kan ti to kha. As I've mentioned earlier, these follicular openings, the openings of the sebaceous gland on the skin surface, are known as open pores. What we usually commonly known as open pores, and usually a person with acne eruptions has an oily skin. Okay, now coming to how it is seen on the surface of the skin. We have two types of lesions, the non-inflammatory lesions and the inflammatory lesions. The non-inflammatory lesions are the ones where we usually call as blackheads, and the inflammatory lesions are the ones with a lot of pus formation. Large nodules can also be formed, and these are usually seen as pustules, cysts, or abscess. Abscesses are like huge collections of pus. Heta india ka hichuanin blackhead kan ti anchi hi chu along lo ni meya blackhead ta po hi kan khoi chuanin I arngeng pa nga ya chang theya pimple lian dewa po chang theya inflammatory lesions an ti angi chu along ti na ni me kha soi tong khanin sebaceous gland khanin activity alo sanga nata shikom sa kha alo punga ka khanin na ya siama lian puin I arngeng pakhat pani pathum te enjoy na cha chang chuanin a inzoma kha ka nai ngai ten om thin ta ni so in Hmaibawl sa de wa hianin nai ngai khopa lian Hmaibawl te om the cyst kan ti ang ka om the ti na ni chu let's see where it is usually seen. It is usually seen on the face, neck, chest, shoulders, and back. Hmaibawl ba ka hianin ngong te om te dar te nung te apol ve the bugani. This is very important. Point C. Usually in a patient with a lot of acne, the skin, the scalp, hair are frequently oily. Mai te lule te sam te amom te chinani. Coming to the causes of acne, there are so many causes that we cannot go into multiple details, and a lot of medical terms are there which will not be very easy to understand for a non-medical person. Number one is endocrine factors. In this, it's written here that sudden onset of acne, treatment-resistant acne, and acne associated with signs of androgenism should lead one to suspect an endocrine abnormality. This is mostly for medical people. And tinan Hmaibawl karonam ta thut faile ka taronam thut te treatment tam takpek nuwa re rei thei lo te tin mundanga me che a mul to dan dik lo te period regular lo te thil chi sang signs aronam tel ka chuan hormonal problem lampang rin hel tur ni atini hela hian le taila let's see this area where there's something which is called premenstrual flares. Premenstrual flares occurs usually 15 to 20 days in the menstrual, between days 15 and 20 of the menstrual cycle, And in this, what happens is the sebaceous duct orifice, the one we were talking about, this opening becomes narrowed, and it will also it can have acne eruptions because this becomes narrow. So as I said, this oil production which is coming out from here will be blocked, and again the same thing will happen. There will be proliferation of the bacteria and acne can occur. So ito ang kanin period ma Hmaibawl chin flare kan nei chin hi chuanin hormonal activity awangin ni som panga som ni bor vela kan period cycle ni som panga som ni na bor vela kan hemi opening a hi alo zim chin ta kha mi zim khanin heta oil production boka kha angai na kal reng sia heta khan atama ain khol khom ta ka khan bacteria kha alo pung le ta kha khan nai te asiama alo ti longa hey bun surface khanin aron ti pong to arang nga ni le ta mai ni. Okay, coming back to the other causes of acne, the out here the point 3 here, it says that a woman on oral contraceptive pills who has been started recently or who has been discontinued recently can have acne eruptions, and some contraceptive induced acne can last for a year or so, and it basically depends on the type of contraceptives which were prescribed, but most of the common ones, they can lead to acne eruption. Heta asoi chu changkhatna hian changkhana damdo e hawa hianin Hmaibawl asiam ve theya changkhana zong khana siam theya ni chuang lawa changkhana e an tan tir khana siam theya tin ti top deu thut khana siam thei boka changkhana zong khana siam thei lo changkhana property chi sang oma chunga a common deu le kan man ho heta hian jaka oral contraceptives that contain androgenic and anti-estrogenic progesterone, norgestrel, and norethindrone acetate may actually provoke acneiform eruptions. Kangka poimoni tiang content of hoka anivek chong lo mai thei. On point B is another interesting point where it's written here. What is the effect of seasonal change? Hmaibawl hi kolum le khovoten danglam na asiam verengem. It is written here that very humid environments or heavy sweating will lead to keratin hydration, swelling, decrease in the size of the sebaceous follicle orifice, and partial or total duct obstruction. Just means that a very humid environment or heavy sweating can lead to acne. Kolum lutuk, humid lutuk, amo thantlag la satkhan maite taksate atibol ve the animeni. Point C here says that if a patient has occupational exposure or other exposure to chemicals with heavy oils, grease, polyvinyl chloride, chlorinated aromatic hydrocarbons, and tars, it can cause acne. And certain oily and greasy cosmetics and creams can also exacerbate acne. Heta injia ki chu kan taksa kan lo toi ve thin cream te oily thilmom te grease te chemical ti sang exposure kan nei chuan kha khanin Hmaibawl te asiam ve theini. This very interesting point D. It's written here that the patient wear occlusive or tight clothing or have any habits that will initiate or aggravate the disease, which means mechanical trauma, pressure, friction, rubbing, squeezing from clothing or athletic wear or from behavioral habits will also cause lesions. For example, an individual with the habit of cradling the chin in his or her hand may develop unilateral lesions at that site. Heta injia kia interesting mema heta hi choning kor thomno hak to deute le maron ronin no na deute khang in a siam the ti mea entirnan sporting activity tinasa in khelmia chonin an thomno te ataita khami khanin rubbing an thomno ato ta wanga in nok le khatiang tangkhanin arngin khalo om ve the thomea het example a pe ka pe chonin entirnan mi pakhatin akhabe borver ka khoi ta se a khoi de lama khanin arangeng kha khamilama chote khana umthe tini. Coming to point E. Point E says that some medications are known to cause acne, and these medications are commonly steroidal therapy. Steroidal therapy can induce acne, and other medicines like iodides, pomades, etc. can cause acne eruptions. Dam merchant kathian in my tibble vet hey thoa hanivik loma se common vera chuan in steroid kan pek chin sports vel an man thin anabolic steroids te point my tibble thea gym vel kal na sa steroid lo sek du wanga steroid lo te po khan my tibble the tina ni chu. So I've mentioned the causes of acne, the pathogenesis of acne, how it occurs, what happens on your skin when an acne eruption occurs, and there are many treatment modalities depending on the cause, how it happens, the pathogenesis of acne. Kalon soita kang khanin Hmaibawl pon ilo taksapol pon thong chu arangeng omnasa kha intin nge kan taksa alawin chan kha kanon tirang tlang kuya kan video le a chuan in treatment ti shang shang oma cream engol chi nge koi chi te in na mai kan ti lo tu te tin hospital a mo clinic a mo kan pan pon ti to chi shang shang oma phang ka try ma thala mem ti thleng kan don review ve ze langa product tam to ka oma ma se kan pan tlang don tilang ze lang kami arangeng omdan chana khan zon na kan nei chon comments ma kan in zot ne. If you have any queries regarding the pathogenesis or the causes of acne, you can leave comments in the comment section. Please stay tuned.